Our final panelist is Dr. Malcolm Portera. He is the Chancellor Emeritus of the University of Alabama system. He was, after serving as Chancellor for 10 years and also serving on the University of Alabama Birmingham System Board. He has retired, and he is now serving the lead role in developing the Global Alliance for Innovation involving the United States, India, Italy, Argentina, and South Korea. He's also former president of my university, Mississippi State.
A few disclaimers first for me. First of all, I'm not a physician, nor am I a healthcare professional. My 8-year-old grandson reminded me recently that, "Pop, you're not a real doctor. You're a book doctor," he said. He motivated me that when UAB decided to give me an honorary doctorate of humane letters, that I suggested to the president of the university that maybe she could make that an honorary doctor of medicine. It didn't work. The second point is that I'm interested in health care as a business economic development driver, and I'm going to share a model with you in a minute. Third, my remarks are going to relate to the Academic Medical Center. That is not intended to diminish the role of the community hospitals or the regional hospitals, but it's simply what I'm experienced with and know. I have a good friend who said to me one time his grandfather told him there were 3 things he should never attempt to do. He should never attempt to climb a barbed wire fence that leans towards him. He should never attempt to kiss a girl who leans away from him. And he should never speak on a subject about which his audience knows more than he did. So I'm going to, if I could, just briefly address the Academic Medical Center and economic development implications. And while I'm speaking about economic development implications, Governor, I want to thank you for initiating this. We recently had a meeting of our Global Innovation Alliance that we're putting together, 5 countries, research institutes, universities, businesses, met in Birmingham for 2.5 days, decided that we were going to focus on 2 areas of opportunity for innovation. One was digital manufacturing, the automotive industry, and the second was information technology and medicine. So those are the 2 areas that we're going to focus on. Your conference, your summit, your initiative, I think is most appropriate. The second thing I want to do is to thank you for your leadership in the area of economic development. Coming from the city of West Point, Mississippi, I want to thank you for your efforts to recreate that economy in West Point. You and your staff have done a wonderful job with that. But talk about large clinical programs and creating jobs. We are one of the largest sites for clinical trials in the United States at UAB, and the medical center occupies at the present time almost 90 city blocks in downtown Birmingham. Growing clinical programs create jobs, as was said a few minutes ago, and the diversity associated with the clinical program is huge at UAB, as it is in the Texas system. Growing research programs create jobs. It's estimated that for every $1 million in funded research, somewhere between 6 and 10 jobs are created. So if you're doing $500 million in research activity, you're creating about 5,000 jobs on an annual basis. Thirdly, commercialization of technology creates new businesses. A new book out by Enrico Moretti called The New Geography of Jobs suggests that for every 1 technology job created, 5 additional jobs are created. 2 are professional jobs, and 3 are non-professional jobs. If MIT's graduates gross product were compared to that of countries of the world, the gross product produced by MIT graduates would rank 9th in size of the countries of the world. Give you an idea of the impact of commercialization of technology. The fourth point is dynamic research programs attract companies. Someone said earlier today it's about deploying capital and deploying intellectual capital. Companies like to come and sit down by or locate near intellectual capital. And then finally, national and international reputations of your state are enhanced by growing the enterprise. I stepped off an elevator in Shanghai a month ago, and there was a guy on the elevator with me, and he was of Oriental descent. He looked at me and he says, "Are you an American citizen?" I said, "Yes, I am." He says, "Where are you from?" I said, "I'm from Alabama." He said, UAB. He didn't comment on the national championship in football. It happened, he had studied at the University of California at San Francisco, and he was aware of the research activity that was going on at UAB. A little bit about it. UAB is ranked 5th of the top 15 academic institutions as a place to work in Scientist magazine. We've just finished the 23rd consecutive year as a top 100 U.S. hospital. We employ 23,000 people and are responsible for 51,000 jobs in Alabama. We are the largest single-site employer in the state of Alabama. Our annual economic impact exceeds $6 billion, and our focus areas are 6: cancer, neuroscience, cardiology, diabetes, infectious diseases, and rheumatology. We were one of the first 11 comprehensive cancer centers designated by the National Cancer Institute. Here's a shot of what is a cluster, sort of along the lines of the corridor that you're talking about developing, Governor. But if you'll see at the heart of the cluster is the Academic Medical Center. We actually have 5 hospital facilities on the UAB campus that are university-sponsored hospitals. The clinical program, the Kirkland Clinic, is located there. The Veterans Hospital is located there. The Children's Hospital is located there. A charity hospital, Cooper Green Mercy Hospital, is located there. But surrounding it are medical centers in the rest of the community. One of the things that we have attempted to focus on is the development of collaborative relationships between the university and those other healthcare enterprises in this area. Here's one I think you would be very interested in. For every state dollar UAB has invested in it, it returns $16.31 annually. Our system operates on a budget of about $4.55 billion a year, $4.55 billion a year. We get about $400 million for this from the state, so we generate about 91% of our budget from some source other than the state. You talk about an economic development leverage factor that is huge, in my opinion. The second point, Innovation Depot, which is a joint venture between UAB and the business community, was recently designated U.S. top technology incubator for 2011. It has spawned 240 new companies. I'm proud to tell you that one sold for $100 million. It was a company that was started by a physician who was a computer scientist trained undergraduate, got a medical degree, and got invested into data mining and developed a system to deal with infections in hospitals using data mining. He's back in the incubator. He sold that company for $100 million. He's back in the incubator with another new company. It uses the iPhone to help elderly populations take the correct medication. You can drop the medication down on a little pad, take the iPhone and take a picture of it, and it immediately tells a physician what medicine the patient is taking and what that medicine interacts with. He's already applied for 9 patents, and he's received 4 patents for the system that he's developed. Let me end with what I think is a roadmap for success as it relates to building the kind of enterprise that Texas has built and that we are building at Birmingham. One is a commitment from the governing board and the institutional leadership that you want to create a program of significant prominence in your state. Create a serious science and technology capacity. Number 2 is a state policy that commits to prominence. Number 3 is state investment targeted for areas of opportunity. My father passed away when he was 67 years old. He had chronic lymphocytic leukemia. He came from an immigrant family in West Point, Mississippi. He finished the 8th grade. He had to go to work because his father died when he was in high school. He used to tell me, as I was growing up, 2 things. Son, there is no free ride. And number 2, son, you got to spend money to make money. So investment is critical here. There are 3 things that have allowed us to achieve some of the prominence that we have achieved. One was a governor several years ago created a program, and the legislature passed an eminent scholars program there, where the state would invest $600,000 and you had to generate an additional $400,000. That was when endowed chairs could be funded with $1 million. That's no longer the case. Number 2 was the establishment within the budget at UAB of a line that has to this point generated $70 million for economic development and medical linkages, and we've used that to attract stars to the campus. And number 3 is the creation of an innovation fund that based its distribution upon your National Science Foundation engineering and science expenditures. So the folks that are rewarded are the people that are doing the research. The next item that is critical is recognition that physician mind power, if we are talking about creativity here and commercializing technology, that physician mind power is a key to success here. It's hiring people that create jobs, not hiring people that are looking for jobs. I visited with the president of India recently. When I walked in the door, former president, Abdul Kalam, he said to me, we are graduating too many children that need a job. We should be graduating children that are creating jobs. So this whole notion of innovation, unwavering commitment to build critical mass and capacity, creating reward structures that incentivize faculty, commitment to interdisciplinary approaches to things, and creation of serious interdependence with community hospitals. We are presently linked with extension campuses in Huntsville, Tuscaloosa, Birmingham, and Montgomery. We not only operate our hospitals at UAB, but we also operate the hospitals for the Baptist Health System in Montgomery, and we have working relationships with hospitals all over the state of Alabama. We are still called, however, UAB, the university that ate Birmingham. Thank you.